Good day. It is indeed a pleasure to present health and safety practices and performance on public sector projects, site managers' perceptions. Firstly, I need to acknowledge the principal co-author, namely Nomakwezi Mafuya. Nomakwezi and I, the presenter, represent Nelson Mandela University. By way of introduction, the Construction Industry Development Board report highlighted the considerable number of accidents, fatalities, and other injuries that occur in the South African construction industry, the high level of non-compliance with H&S legislative requirements, and a lack of sufficiently skilled, experienced, and knowledgeable persons to manage H&S on construction sites. Secondly, the South African construction regulations allocate a range of H&S responsibilities to all construction project stakeholders. Given the status of H&S in South African construction, the requirements of H&S legislation, the functions of site managers, SMs, and the state of H&S on the East Cape Department of Roads and Public Works projects, the study was conducted among site managers based on such projects, the aim being to assess H&S related experiences and practices on those ECDRPW's projects. The objectives will be noted in the tables which present the findings. The research sample stratum and method was quantitative, focused on 7 school construction projects. The sample stratum was constituted by the 40 contractors, site managers that were involved with the projects. The questionnaire consisted primarily of closed-ended questions. 33 responses were received and included in the analysis of the data, which equates to a response rate of 82.5%. Research findings, Table 1 presents the frequency at which 16 H&S actions are undertaken on ECDRPW's projects on a scale of never to always, the mean score being between 1 and 5, the midpoint of the range being 3. It is notable that all the mean scores are above the midpoint of the range, and therefore the actions can be deemed to be taken frequently as opposed to infrequently. The top 4 ranked are ensure that designer takes the H&S specification into consideration during design stage, assess whether the PC2 appointed has the H&S competencies and resources to carry out the construction work safely, provide the H&S specification to contractors at bidding stage, monitor the development of the H&S file. Those 4 actions are all client related. Table 1A and 1B indicate that 15 of the 16 actions mean scores fall within the upper range, greater than 4.2, less than equal to 5. That is, the actions can be deemed to be taken between often to always. Table 2 presents the frequency of H&S training on ECDRPW's projects on a scale of never to daily, the mean score being between 0 and 7, the midpoint being 3.5. All 5 mean scores are above the midpoint of 3.5, therefore the 5 types of H&S training can be deemed to be taken frequently as opposed to infrequently. Notable that the top 3 ranked types mean scores are greater than 6.13, less than equal to 7, therefore they can be deemed to be taken between weekly to daily. Table 3 presents the frequency at which 4 ergonomics problems are encountered on ECDRPW's projects on a scale of never to daily, the mean score being between 1 and 5, the midpoint being 3. It is notable that all the problems' mean scores are greater than 3, which means that they can be deemed to be encountered frequently as opposed to infrequently. Only 1 mean score falls in the upper range, greater than 4.2, less than equal to 5. That is repetitive movements. Table 4 presents the extent to which 10 factors contribute to exposure to hazards on construction sites on a scale of 1 minor to 5 major, the mean score being between 1 and 5, the midpoint being 3. All mean scores are above the midpoint of 3, which means the factors contribute more of a major than a minor extent to exposure to hazards on construction sites. Table 5 is presented in two parts, and it presents the frequency at which factors are the cause of construction accidents on a scale of never to always, the mean score being between 1 and 5, the midpoint being 3. It is notable that only two factors have mean scores above the midpoint of 3, namely employee negligence and inadequate worker participation. And therefore, they can be deemed to be the cause of construction accidents frequently as opposed to infrequently. It is notable that inadequate design high-risk is ranked last with a mean score of 1.84. Qualitative findings. First category, comments with respect to the meaning of H&S, brother's keeper, life depends on it. Second category, views with respect to the construction regulations, employees benefit, proactive, reduce problems, contractors, good base to work from. The last category, comments in general with respect to H&S, work smartly, appointed supervisors have inadequate. Conclusions. Clients and designers are to a degree complying with the requirements of the construction regulations and contributing to project H&S endeavors. A multi-stake approach relative to H&S is realized on ECDRPW's projects. Training is undertaken frequently as opposed to infrequently on ECDRPW's projects. Contractors are to a degree complying with the requirements of the construction regulations. Construction is physically demanding. Daily activities entail exposure to economic hazards. Hazards are primarily attributable to contractors. A range of contractor-related inadequacies contribute thereto. Contractors are primarily the origin of the causes. The management of contractors has a predominating role to play, especially in terms of H&S training and worker participation in H&S. The respondents' comments indicate they have a positive disposition with respect to H&S related regulations and that they have an understanding and appreciation of the intentions thereof and the issues with respect to construction H&S. Recommendations. H&S awareness should be maintained at industry sector, organization and project level among all stakeholders. The construction process and its activities need to be re-engineered. Designers have a role to play to facilitate such re-engineering. Worker H&S training must be intensified. Worker participation must be promoted. Constant H&S feedback must be provided. H&S must be addressed from stage 1, included in the project charter, addressed throughout the other 5 stages, addressed during all project-related meetings, and the management of all stakeholders should be committed to H&S, be involved in, and support H&S endeavors. Lastly, planning by all stakeholders in general is important to ensure that H&S is integrated to the design, procurement, and construction process.